Oh, that'll work.
Hey, Will, can I just do that?
Yeah, that'll work.
Okay, I couldn't get it, and Andrew's on the phone, and it doesn't sound like it's any easier for him.
Oh, okay.
All right, I'm just gonna hold up my iPad, Andrew, with the picture of it.
Perfect. That will work.
Okay,
All right,
thanks.
I'm gonna log in.
Okay, bye.
Thanks. Bye.
All right, I'll just do that, Will, then. Not ideal.
Hi, everybody.
Hello.
I finally got a camera for my desktop. So I get to be at my regular desk instead of the conference room. So
Great.
I'm happy about that.
We keep improving.
That's right.
Mr. Johnson, can you hear me? My audio seems finicky.
Yeah, Tommy, I can hear you. It is a little off, but I can hear you.
Hey, Will, this is David Brace. Can you hear me?
Yeah, David, I can hear you.
Will you send Steve King a link? He's the acting engineering chief right now and needs to sign on.
Yeah, I just got an email from him and I've just sent that to him.
Thank you, sir.
Mhm.
Are we missing one council member? Oh, no, I think everybody's on.
Mr. McMahon, we're gonna turn your video off. We'll just have council and the mayor visible for most of the meeting. So we'll stop your video.
Okay, it's 6 o'clock. With all members present, I'd like to call this meeting to order. Who's going to do our invocation and pledge this evening?
Mr. Smith will be giving the invocation and Councilman Testerman will be giving the leading us in the pledge.
Okay, thank you.
Thank you. Can you hear me okay? Okay. Dear Lord, we gather here tonight in pursuit of a better Knoxville. Please be with those in our community who need shelter, food, healthcare, and hope. Please allow us to make wise and compassionate decisions. Amen.
Okay, here's my flag. I pledge allegiance to the
To the flag
of
of the United States of America and to the republic
for which
for
it
which it stands,
One
one
nation,
nation, under God,
indivisible,
visible,
Liberty.
with liberty and justice for all.
Mr. Johnson, would you conduct a roll call, please?
Councilwoman Fugit,
Here.
Vice Mayor McKenzie,
Here.
Councilwoman Parker,
Here.
Councilwoman Ryder, Councilwoman Ryder,
We can't hear you.
Here. Can you hear me
Now.
now?
yes, ma'am.
Hmm.
Councilman Roberto,
Here.
Councilwoman Singh,
Here.
Councilman Smith,
Here.
Councilwoman Testerman,
Here.
Councilman Thomas,
Here.
Councilman Thomas.
Here.
Thank you.
Okay, roll call finished?
Yes, ma'am.
Okay. Next item is approval of minutes. Is there a motion to approve the minutes from April 7th?
Move to approve.
Second.
Motion made by Vice Mayor McKenzie, seconded by acclamation. Please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Okay, the minutes have been approved. 9-0. Next item, announcements and extraordinary matters and adoption of agenda. Are there any items council members wish to withdraw? Vice Mayor McKenzie? No, okay. No items to withdraw, okay. Any items for postponement? Okay, no items to postpone. Any items to be added by motion? Okay. Any, oh, is someone raising their hand? No, okay. Is there a motion on consent items?
So moved. Move approval.
Second.
Councilwoman Fugit moved to approve the items on consent and seconded by Councilwoman Ryder, I think. Any discussion? Okay, would you please conduct a roll call vote?
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker. Councilwoman Parker,
Sorry.
are you ready to vote or would you like to pass?
Yes. Yes, I'm
Okay.
voting yes.
Thank you. Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas.
Yes.
Okay, the consent agenda is approved 9-0. Next item is mayor's reports. There's a lot going on, as you guys are aware of. Real quick, I'll start with a COVID-19 update, and I'm just going to say a few things, and then Dr. Martha Buchanan, the head of our health department, has graciously decided to, agreed to be here today to answer some questions. And so I'm going to let her share some remarks and then answer some questions from council. But before she starts speaking, some of the recent test results show that our curve is flattening. The social distancing and the safer at home precautions seem to be working here in Knoxville. I want to thank everyone who is working so hard, all residents and businesses, for doing their part. The other bit of good news is our hospitals are not overwhelmed. They've been very collaborative and careful and preserving and conserving PPE for their people on the front lines who are very vulnerable to infection. And so far, very few people who have been diagnosed with COVID-19 have been hospitalized. And of those, our hospitals have not been overwhelmed. So we have, looks like we are meeting some of the criteria that I mentioned weeks ago that would help us consider lifting some restrictions. And the criteria I mentioned were, 14 days of flat or diminishing number of new cases, and also that our hospitals had the capacity to handle COVID cases in a way where that was safe. So I'm very aware that the safer at home order, while it has worked to flatten the curve, it's also imposed great economic hardship on people losing wages and closing businesses. And you all are well aware of that because you run businesses or work or, know people who do. So I feel that pain, and I understand that people are eager to get back to work so they can pay their rent, and pay their bills, and pay their mortgage. And you guys are obviously very aware of Governor Lee's announcement that as of May 1st, he's going to be removing some of the statewide restrictions. Although I think it's important to know that will change some of the things as far as non-essential businesses being allowed to reopen in counties, that do not have their own health department. Knox County is one of 6 counties in Tennessee that has its own health department. So we are working with Dr. Buchanan to make sure that we have a plan that works well for Knox County. And of course, the city of Knoxville is our particular interest. So With that, I would like Dr. Buchanan, if you could show us, since you're going to be able to answer some questions for us, if you could show on your, reveal your face on the video if you're able to. I think that would just help facilitate communication a little bit, because it's just nice to, we see your face every Monday, Wednesday, Friday during the press conferences, but we're really glad that you're able to participate in today's Zoom meeting with City Council, because there's just a lot of, everything's changing very quickly, and hearing directly from you about what's happening from your perspective and how you think, and able to answer some questions, we'd really appreciate that. So Dr. Buchanan, if you want to share a few things, and then we'll take some questions.
Absolutely. Thank you. Can you guys hear me? Because I'm new to all this. So thank you for giving me time on your agenda to speak to you about what's going on with COVID-19 in our community. I appreciate Mayor Buchanan's support as we work through this unprecedented time in our community, in our nation, and quite frankly, in the world. So thank you for the time. Thank you for what you're doing to support the efforts of the health department and to protect our community. Just a little bit of information about where we are. We currently have 196 confirmed cases of COVID in our community. 165 of those have recovered. That's great news. 27 have been hospitalized at some point in their illness. And again, today, we are very grateful that we can report that there have been no further deaths to COVID-19, from COVID-19, excuse me, in our community. And so I appreciate that. We're grateful for that. A little bit about what we're doing as the health department. We are doing contact investigation and tracing 7 days a week. We have a team. We have several teams who do that. We have about 34 people dedicated to just that right now. We anticipate, as we do reopen the community, that our cases will go up. That won't be a surprise. People are getting out, connecting with one another, and sharing things, including COVID-19, which will be why it'll be so important when we do reopen, that we continue social distancing, that we do it safely, we do it slowly. We're very thoughtful about how we do that. We are testing right now 5 days a week with some plans for some increased testing on the weekends. I believe we've confirmed the location and a time potentially for Saturday to do a testing event. I don't want to give out too many details because it's not confirmed yet. My staff is still working with the state to confirm the support from the state to be able to do that. Part of that support will be in testing supplies so that we're able to perform that testing event. We are locating that in East Knoxville. When we look at where we, the Knox County Health Department, have tested people where they live, East Knoxville is one of those areas where we don't have a lot of folks that we have tested in that area, even though we're really not located all that far from that area. So we're locating that in East Knoxville, and details of that will come out tomorrow or the next day once we have everything firmed up. You don't want to get anything out there and have to retract it. So as you know, we started to increase testing this week, 5 days a week. We tried to just do kind of an open, y'all come kind of testing that really kind of overwhelmed our system. And we have had to back off on that. We won't be testing. We'll be testing at our facility tomorrow, but we won't be doing a drive-through test tomorrow because we're having to kind of regroup on that. We tested over 300 people, about 300 people on Monday and about the same number today from across the county. And so we're having to regroup a little bit on that. Testing supplies continue to be our biggest challenge. And it's not just us, it's across the country. It's hospitals, it's providers. Everybody's challenged with having enough testing supplies. We are working every day to get testing supplies to the different ways we can get them through our traditional supply chains from the state of Tennessee Department of Health. But again, it continues to be a real challenge. One of the challenges is actually we have been successful in our social distancing. Our case count is not that high. So we're not a hot spot in the state. So resources are being reallocated to those hot spots in West Tennessee. So it's not a bad thing, but it makes it challenging for us here on the ground. As you know, we have a map out there of testing locations. There's been a little misunderstanding. Those are not our testing locations. Those are outpatient providers, walk-in clinics, doctors' offices who've told us they're testing not just their own patients, but testing for the general public. So we've put that out there so people know where they can go get tested. If their provider isn't testing and they have insurance, and they can go there and get tested if they want to. So again, those are places where they're private offices who are doing testing, and we're grateful for that. But that, again, we have no determination of where those are located. Those are based on a business decision by that company on where they're going to locate a clinic. And as you know, we've also, or if you've gone to our website, you also see that we have a map of where the cases are, and also been a little confusion about that map. That map is really just to say there are this many cases in this zip code. It's not about risk. It's not about anything else other than there are this many cases in this zip code for informational purposes for our community. And we continue to, we're working with the city to craft a reopen plan so that we can provide guidance to businesses and to the community on what reopening looks like, because we're not exactly sure what that looks like. None of us have been here before. And so we're all kind of learning together what this could look like. We believe that the business community and the community need guidance to feel safe going back to business. It won't be business as usual. It won't be business pre-pandemic. It'll be a new normal for us for a while, and social distancing is going to be the norm for us for quite some time, to be honest. So I think we all need to get used to virtual things and social distancing for a while. In anticipation of a vaccine probably isn't going to occur until maybe next year. Treatment might happen before that, but a vaccine is probably at least next year before we'll have that available for anybody for general public access. And with that, I will pause and take questions, because mostly it really was an opportunity for y'all to ask questions of me.
Thank you so much, Dr. Buchanan. I want to first just say you and your team at the health department have been working incredibly hard in a very, very difficult circumstances. And I see that, and I know council does too, and we appreciate it. And just super grateful for all your hard work every day. I also want to just commend the transparency that you have. The website's really good. And every time people have said, well, I'd like to see a map. And then like the next day there's a map, and people say, I'd like to see the demographics. And then you share that. So thank you. Thanks for being transparent. People really wanted a test site in East Knoxville. And it sounds like you've been working on that. And I know the details are yet to be announced, but I'm very grateful for that too. So, so thank you. And I'm going to let council members ask some questions. Councilwoman Fugit.
Thank you, Mayor. Dr. Buchanan, you're talking about guidance. Do you have any idea or any time frame when you and the team that you're working with will be able to provide some guidance, as one of those people who's anxiously awaiting it?
Absolutely. So the way we're looking at this is we actually are waiting for the governor's guidance to come out so that we can kind of fold in what we're doing to be supportive and complementary to that guidance, so that, we all know that competing or different information from leadership is one of those things that, one, creates some fear and just creates confusion. This is confusing enough. We really want to be able to fold into that. So we're working on that. Once we see the governor's guidance, we'll look at that and marry the two up so that they look, that businesses here aren't having to figure out what are the rules in Jefferson County versus Knox County. So hopefully that'll be early next week. That's
what I was thinking. If I would assume that's for sure by the end of next week.
Mm-hmm. Yes,
we would hope. Thank you.
Mm-hmm.
Vice Mayor McKenzie.
Thank you, Mayor, and thank you, Dr. Buchanan. Very pleased to hear that there's going to be a testing site in East Knoxville. As we all know, that East Knoxville is one of our most vulnerable communities. We all have seen, even from a national level, the disparities among African Americans as it relates to this virus, as well as just healthcare in general. I would like to ask you, is this going to be a temporary testing site, or will it be testing on an ongoing basis, even if it's certain days of the week? In addition to that, I'd like to ask if there will be any plans or any insight into testing in additional communities that are vulnerable, such as Lonsdale, Mechanicsville, and Vestal.
So at this time, honestly, in part due to staffing capacity, and testing kit capacity, right now this will be a one-time event in East Knoxville. We will continue to do 5 days a week. We'll continue to do testing at, I believe we're going to keep that at the location it is now, which is Engineering and Public Works building, which is not the easiest building to walk to, but it is on, I believe, on a bus line and can be accessed that way. We also are doing walk-up testing at our main facility, which is located, as you know, just north of downtown. So we're trying to accommodate those needs. We're also really encouraging providers in the community to be doing testing. And I know that Cherokee Health has been doing some testing. I've talked to Melissa at Interfaith, Melissa Knight, and I believe they're doing testing as well. So we're encouraging providers to do that testing, especially the providers who are working with folks that are higher risk. We are considering looking at other testing locations around the community. We don't want to stand something up and not have the supplies to do it. So we like to have those supplies in hand before we do it. This week has been an example. We thought we had enough to make it through the week, and we ended up not having enough, and we really hate to do that. So again, we continue to, and again, it's not limited to us. All of us who want to test continue to struggle to get those supplies. And I know that you hear nationally and even at the state level, there's no problem with supplies or access, but supplies are a challenge. And it's not necessarily PPE for us. Some places are having challenges with PPE, but that's less of a problem than actually the supplies to collect the specimens. And the lab capacity is also a challenge. So we'd love to do more. We just hate to overpromise.
So Dr. Buchanan, let me follow-up question. What is your potential capacity for testing at the one-day event that will be held in East Knoxville?
Now you're testing my memory. I think we plan on, don't hold me to this. I believe the number is that we want to be able to do 600 tests on that one day. But again, that's my memory based on what my staff told me earlier today. And just for reference, we did about 300, a little more than 300 yesterday, probably about the same number today. So we're setting up so that we can do multiple lanes and have a faster put through, as we call it, so more folks can go through and get tested at the same time.
Okay.
Ideally, that's what will happen.
Okay. And I know, I'm sure the mayor has, or her staff has shared with you that there was a conference call last week at the request of several community organizations that were very concerned about the lack of testing in our vulnerable communities. That call did actually have some healthcare professionals that were on there. So I don't know if there will be opportunity to maybe partner with some of those licensed healthcare professionals to do some additional screening if it's a staffing capacity or even partnership with Cherokee Health. But I really feel like we have got to target those communities. We really have to do that. I think that you understand the urgency to that. And I would just like to ask our mayor as well as the county mayor, if they will just continue to partner to do whatever we can to make sure that that happens. Again, there's really high concern for those populations, and I just wanted to express that today.
Sure, thank you. I understand there, and we are concerned about those populations as well, and how to penetrate that community with access to testing. So we are looking for different options, and I think again, some of the challenge comes back to having supplies to do testing. So Cherokee and is not alone, and we're not alone in that challenge. It's a problem across the country.
Thank you, Dr. Buchanan and Vice Mayor McKenzie. Ms. Testerman.
Well, first of all, thank you for everything. I know your team has been working overtime, needless to say. So appreciate that. I feel like today I might have heard some conflicting messaging. So just to clarify,
Sure.
Is it appointment based or are you able to drive up? It seemed like it was drive up and then it may have switched back to appointment based. So I just wanted to clarify, and you may have said it already.
It did switch back, and that was in an effort to conserve supplies. Thinking about trying to do an event on the weekend, trying to conserve supplies so we have enough to do that event on the weekend. As I said, the response to the y'all come, drive up, get tested was pretty overwhelming. And we were, probably shouldn't have been, but we were a little surprised by the volume. So in order to have enough supplies to continue, we have had to cut that back to appointments. We still expanded the requirements. So we expanded the symptom list to be what they're calling COVID-19 like illness. So that it includes the 3 big ones: fever, cough, shortness of breath, but it also adds headache, chills, myalgias, body aches, or loss of taste or smell, which is a weird one that they're seeing in COVID-19. So that expands it a little bit. We also expanded it to have more access to folks who are higher risk for complications. And I'm not going to, those are folks with other illnesses, or maybe they're a contact to a confirmed case. So trying to expand that cautiously to not use testing supplies up too quickly, because we also have to maintain supplies to be able to test contacts of cases that are symptomatic. So it's a real challenge, but that did change. That messaging is hard. And it was a decision we had to make today that was unfortunate.
Thank you.
Thank you, Councilwoman Testerman. Councilwoman Ryder.
Dr. Buchanan, thank you. And thank you for the daily updates as well. And I know, well, I should say they went to about 3 days a week. And I know I heard today you guys were going back to the 5-day-a-week format. So appreciate that response. Can I ask you about contact tracing? I think that's going to be, is your opinion that it'll be incredibly important as people try to move back and open back up in a slow, metered fashion? But you said, I believe you said a few minutes ago, you had about 34 employees that were doing that. I'm assuming those are employees that shifted to do that from other things. Is there an anticipation that you'll need more people to do that? And they'll be shifted from other places within the county or something, or some other, maybe within the healthcare or the city or something, to be able to fill those roles if needed. But then the other part of my question is there an education component for the community in terms of being prepared to maybe log where we've been and who we've been in contact with? I know I heard one story of a woman who had COVID-19 positive and experienced it. I believe she was able to stay home. This was not here. This was somewhere else I saw in a news report. But she talked about being able to answer those questions because she wasn't thinking about it and wasn't logging where she had been because it wasn't in her field of thought. And so I wonder if there's a way that we could kind of educate people to just be kind of mindful of what we've done, because I know it's really easy to forget where you've been and what you've done and who you've been in contact with.
Sure. So it's a great point, and certainly something to remind people to think about. You're correct. Contact tracing will become, as we get more cases, as people go back to work, contact tracing will become more and more important. Right now, because of social distancing and the stay-at-home order, we're only having about 4 or 5 contacts per case, which is great. That number will go up as people get out and about and have lunch with friends and do other things. We obviously start with the family and move out from there. So yes, logging where you've been is a good idea. The nice thing about COVID-19 is we are not going, sometimes we have to go about like a week or more back in people's memory to say, where have you been? With COVID-19, we only go 2 days prior to onset of symptoms based on science and incubation and all that stuff, and infectious period. So what's really more important is if you're sick that you self-isolate until you know what you have. So if you self-isolate, then your contacts 2 days before are the only ones we need to know about. And if you've self-isolated, you're not gonna have a bunch of contacts during isolation. Anyone who gets tested, regardless of their symptoms, should self-isolate until their test results come back. That keeps them from exposing others in case they are actually a case. But not a bad idea to write down where you've been, because I can't remember what I had for lunch yesterday. So asking people to go a few days back in their memory is a challenge. So not a bad idea at all.
I just would like to comment, maybe that needs to be information that's on the website. I don't want to have people be paranoid or overly anxious about it, but just as we move forward and we start reopening, I think that's a component that people need to be prepared for, and maybe an education component so that people can be just mindful without being anxious about it.
Yeah, and I think I didn't answer your question about staffing up for contact tracing. Our plan is to activate our staff. We have a few staff to activate. We don't have many right now because most of them are working. But in addition to that, the county mayor has committed to letting us pull in county staff as needed. We also could reach out to other contacts that we have. And even I've thought about, can we activate any school staff? Haven't talked to Superintendent Thomas about that, but seems reasonable. Those are folks that could help us do that, because it really is, it's really you need to be detail oriented and a good listener and take a good history to be able to do contact tracing.
I'd just like to add, Dr. Buchanan, that I certainly would be happy to offer city staff.
Thank you.
As needed, and as their, skills and time allow. But I like those are good options, and hopefully we have a good containment strategy, and we have contact tracing needs, but not needing in the thousands, but more hundreds. Are there other questions for Dr. Buchanan? Yes, Councilman Roberto.
Thank you, Mayor, and thank you, Dr. Buchanan, for this brief, all the information you've been bringing to our attention, and then our conversations as well. I wanted to ask about antibody testing. I know we've been talking about if you're sick, isolating, and there was great questions already today about follow-up and contact tracing and how to get testing if you're not feeling well. But do we have any activity in antibody testing? And maybe could you talk a little bit about what that is and what kind of information it can provide for us?
Sure. So antibody testing is something that we use with other diseases on a regular basis to see if you're immune. Unfortunately, antibody testing for any new illness, not just COVID-19, has to be validated over time. So the antibody testing that is available, it has not yet been validated for use in patient care. It's still validated, it's still recommended only for experimental use. I know that local labs are working to validate the test so that we can use it. So just a little 101 on antibody testing. Antibody testing tells us, tests you for IgM and IgG, or both. Those are antibody markers. And IgG is the first thing that you produce when you get sick. IgM is the first thing you produce when you get sick. IgG is the second thing. And if we see IgM, we know you're acutely ill. If we see both, you're probably recovering. If we just see IgG, you are considered to be immune. But with COVID-19, again, I'll go back to that testing has not been validated. I think there's a problem with crossover with other coronaviruses, such as the virus that causes the common cold. So it's not ready for real-time use yet. We're hoping that it will be soon, because that would be really helpful. It's a test that can be done with a finger prick in the office most of the time. So we're hoping that'll be available soon.
Thank you, Dr. Buchanan.
Sure.
Any other questions for Dr. Buchanan? Councilwoman Parker.
Yes, thank you, Dr. Buchanan, for being with us here tonight and answering our questions. I really appreciate it. I had a few questions. One was a clarification about the test Knox County is hoping to get from the state in a few days or this weekend. Are we guaranteed to get additional tests? And if so, how many do you anticipate we'll get?
We have asked for 600. We are not guaranteed to get those. Until we have them in our grasp, we are not guaranteed to get those. The state has the ability to redirect resources as they see fit. I know that they have been fulfilling those orders. The governor has made a push. He wants testing to be done across the state. So he has been encouraging the fulfillment of those orders so it can be spread across the entire state. And so we're hopeful that we will get those, but we don't have a guarantee. And so we will have to, if something happens and we don't have those, we'll have to reschedule the testing event we have planned for this Saturday. So we're very hopeful that we'll get those. My staff talked to staff at the state this afternoon, and our understanding is that we should get them, but I don't count on it until I see it.
Okay. And that somewhat speaks to my next question, but you know, we've seen concerning stories throughout the country of hotspots popping up in vulnerable places. We've seen a report out of Bledsoe County of a spike in positive cases once more testing was done at a prison. Is there a plan in Knox County to do some comprehensive testing at vulnerable places like jail and nursing homes?
Well, actually, we're working with our jail, and they have a plan in place that they've implemented, and are testing folks as indicated, and actually quarantining folks appropriately. They're actually doing a really great job, and we're working closely with them to make sure they have what they need to test when they need to test. We also, through our regional hospital coordinator, have worked with our long-term care facilities to make sure they have access to the PPE they need. If they get a single case in a long-term care facility in Knox County, we will work with them very closely to isolate the other patients and get everybody tested. If you remember, we've had a couple of cases, at least 2, there may have been more in that one facility, in a facility in Knox County, and 2 employees were ill as well. Everybody else got tested and everybody else was negative. So that methodology worked. They did a really great job of isolating the case to an area of the facility so that other people weren't exposed. So that worked really well. And like I said previously, we are looking at if we can secure supplies to do other testing, offer testing in other areas in Knox County as we can. And so we also are working closely with the city and VMC and CARM to get any at-risk homeless folks who have symptoms to get them tested and out of that population so that we don't have cases among our homeless population.
It seems like if the county or city even wanted to, you know, for instance, among our homeless population, just, you know, test everyone, even asymptomatic folks, we don't have access to the testing to do that.
We don't. We don't have limitless testing supplies. You know, as somebody who practices evidence-based medicine, you know, testing asymptomatic people is one of those things that kind of goes against evidence-based medicine. We really look at testing symptomatic people for anything, regardless of what we're talking about and regardless of who they are. So using our supplies wisely, testing, mostly focusing on symptomatic people and people who have had an exposure is the best approach while we have limited supplies.
Okay, thank you.
Sure.
Any more? Oops. Any more questions from council members for Dr. Buchanan? I have a question.
Sure.
So, well, I guess I'm looking forward to working with the health department. A lot of business, I mean, we have been working together, but now we're reaching, you know, it's like every week there's a new decision-making point that's super critical, that's getting a lot of public attention and angst, and another one is upon us. And I'm getting a lot of feedback from business owners. They want to reopen, but they also want to be sure that their employees are safe and that their customers are safe. So I guess I'm looking forward to working with you and the state and other task forces to sharing guidelines with entities that, I mean, these criteria and guidelines can be consistent across the nation, really. Whether if you're a barbershop in Minnesota or in Tennessee, you know, those standards should be the same. So I'm looking forward, because I think businesses want to reopen, but safely. So thank you for helping us work on that. The one question I have is sort of about timing, you know, because we are definitely better off than the other major metro areas in Tennessee. But, you know, we have some instances of COVID-19. And what I'm really a little worried about, and what I hear concerns about from city residents, is that we start lifting the restrictions and then people relax their guard. And then we expect to see an uptick somewhat because, as you said, as people circulate out in the community more, they're interacting, and the chances of interacting with someone who may be contagious and not know it go up. How can we get people how can we lift some of those restrictions, but also encourage people to maintain their guard and say, okay, yes, I will be going back to this office environment and earning my, going back to my job and earning a living, but I know people, for example, that, they've said, well, if you're vulnerable, just stay home. If you're surviving from, if you have an immunosuppression issue, stay home. If you are really old, you're more vulnerable, stay home. But there are people who feel vulnerable and have immunosuppression issues who can't stay home because their bosses are going to be like, you come back to work and we'll give you some gloves and a mask and you go. Or maybe they don't even provide a glove and mask. So tell me, how we can start lifting restrictions, and also, I know there's no guarantees, but how can we assure people that we're going to deal with, not drop our guard?
That's a great question. And to be honest, I think the message I want people to hear, and all of you to hear, is that is really up to all of us, businesses, citizens, churches, communities, whether or not we are able to open slowly in a stepwise fashion and stay open. Because if we open slowly in a stepwise fashion and people do let down their guard and we see a significant spike in cases, we'll have to regroup and say, okay, we tried to open, but now we're going to have to back off on that. So one is giving, clear guidance to businesses on things they should do. I think education and information is power. And if we give businesses clear guidance, they're going to follow that. Nobody wants to have to close down again. Excuse me. And we need to give clear guidance to the citizens and give them some responsibility for maintaining what level of open we can have, and then being able to go to the next step, and maybe we celebrate those steps, by saying, hey guys, we did it. We're opening to the next level. I don't know what that looks like. But it's a combination of information, education, and empowerment. That's what we have to do to empower our community to move forward. The successes we have now are due to the work of my staff, but they're also due to the work of our community. And so we want to maintain those and not lose that momentum. So that's the way I see it. And that's why we're spending so much time on trying to create a plan with some very specific guidance for businesses and for the community on how to stay safe.
That sounds good. What if like part of the guidance is, say, for you know, a business to provide masks for their employees. And then they're not able to acquire masks. Do they still get to open? I mean, like, you know, those are like, what if they say, okay, I've read the guidance, and then and they say they're going to follow it, but then you know, someone comes to the health department and says, you know, I work at this store, and the guidance you issued said they're supposed to give me gloves and the masks, but they're not. What
I think,
happens then?
you know, we do regulation every day, and our approach to regulation is really about partnership and education and information. When we have to, we close things down, but we acknowledge that when we do that, we're not just impacting that business owner, we're impacting the people that work for them, who might be hourly wage workers, who are going to now have to choose between, you know, rent and food or whatever they have to choose between because they're not taking home a paycheck. So we're very cautious about that. So, you know, what my staff will do is reach out and educate those folks, offer them resources to be able to obtain the things that they need to be able to allow their employees to work safely. You know, it's really, we public health are not in the business of closing down businesses. We're really in the business of protecting health. Sometimes that means businesses have to close, but usually we can get people to be cooperative, especially if we give them resources and information.
Right. Well, I totally agree with the message of empowerment, and that information and resources are part of that. So I wonder also, you said that at some point, if we drop our guard and aren't as careful as we need to be, we might reach a threshold that we need to, you know, regroup, as you said. So I think it's important to share with the public what those thresholds might be. So then if it, like, let's say, you know, right now we maybe just have 2 new cases a day, but maybe in 3 weeks, what if we have 50? Is that a threshold that we?
I don't know yet.
Yeah.
I don't have that number because I don't think we know what reopening, what change that's going to cause. So at the beginning, we're going to have an increase. And honestly, for those of you who, like the state tested 11,000 people across the state last weekend. Those tests are going to start rolling in. Those results are going to start rolling in. And it's going to look like we have a spike because we're going to get new cases, all from those couple of days of testing. And we have to watch that and look at it and observe it. So it's really based on the trend and the data and how we can look back. You know, if we look back and say, okay, all of these people were tested that one weekend, that's not necessary. I mean, that's an increase, but that's also an increased access to testing, which we know is going to increase cases. So I think we have to look at all the factors together, and we can't base it just on testing. I'll be honest, because our testing capacity is so limited, and I don't see it getting a whole lot better. We're not a hotspot as a state, and we're not a hotspot in the state. So hotspots are getting all the attention. It's not a bad thing. They need all the attention. So when my staff and I have talked about this, and the way we track flu is we look at doctor visits for the flu, we looked at hospitalizations, and we look at deaths, and we look at testing. We look at all those factors. We already have a way to track those visits in one of our systems called, I think it's called Essence. It's our syndromic surveillance system. The state's already built the syndrome of COVID-19. So that's one way to track. People go to the doctor, they have those symptoms, and we can see that a lot of people are going to the doctor or fewer people are going to the doctor for those symptoms. Hospitalizations are pretty easy. Deaths are obviously, unfortunately, easy to track as well. And then the testing. So we combine all those pieces of information and the situation in the community to make that determination. So I don't know if we're going to be able to say, if we hit this, we're going to close things down. That'd be nice. It's not that neat.
Okay. All right. Well, it's really complicated and hard, and I appreciate your time and expertise. Councilwoman Parker, did you have a question?
Yeah, if I could ask one last question. I just remembered in your press conference, Dr. Buchanan, I believe you said that the county's safer at home order has already expired, but the state order is still in effect.
Yes.
So nothing has changed until the state order expires.
Correct.
Okay, I just wanted to clarify that.
Yes,
Thank
ma'am.
you.
Well, and just to clarify also, the city of Knoxville, we have our own order, and then we adopted the health department, the Knox County order, verbatim, so we could work together on enforcement. And that's been a really good partnership. I think that, the health department's used to enforcing this kind of thing, and it's a new thing for the city, but I think Ronnie Neese and the other team of people working with Peter Ahrens and some of our fire inspectors. And again, we follow the approach of the health department that it's a partnership and it's about informing people and educating people. And we also in the city are not in the business of closing things down. We want to keep things open, and also consistent with public health advice. So, yeah. All right, I don't have any more questions. Any other questions from council members? Okay, Dr. Buchanan, thank you so much for your time, and we'll be in touch again soon. Thank you.
Thank you.
Okay, let me get back to a couple more things I wanted to mention to you guys. In addition to the work that we're working with the health department, last week we also convened a task force of the major metro areas. The Chattanooga, Nashville, Memphis, and Knoxville are working together to have this task force of health workers, health experts, as well as business experts to examine the criteria for reopening the economy. So thank you to Deputy Mayor Stephanie Welch. She's the lead on that for the city. As you all know, Stephanie has a lot of qualifications to serve in this role. In addition to her work on economic stuff, she's also a major and an executive officer in the Tennessee in the military, Army, and has also previously worked at the health department. So the other people that we appointed are Kathy Brown, who's the leader at the UT Department of Public Health and a former regional epidemiologist and director of community assessment and health promotion at the Knox County Health Department. On the business side, we have Dave Miller from First Horizon Bank. He's the regional president of our First Horizon Bank here in Knox County in East Tennessee. Mike Odom, the head of the Knoxville Chamber. And I also thought it was important to have a small business representative on there. So Ryan Steffi, who's the manager of Sono Taco, and also has a background in emergency management work. So, just to reiterate, I do realize that people are out of work and struggling economically, both business owners and workers. So we are working hard to, strike this balance between reopening the economy while also trying to protect people from this pandemic. And we've done a good job on social distancing, and I'm confident that we can move forward in a way that's measured and data driven, and hopefully, reopen the economy slowly and gradually in a way that makes it so we don't have to close it down again, because that would also be bad news for our economy and our health. So also in the meantime, I'm going to be proposing a significant city-funded initiative to help those hurt by COVID-19 shutdowns. I'm talking about city dollars that will complement assistance available through the federal and state governments. But we were going to be focusing intensely on local Knoxville needs that aren't being fully addressed. So that's a segue into my next topic, which is the city budget. One of the many events that has been canceled due to COVID-19 was the State of the City budget presentation. Usually we have a large gathering and a brown bag lunch under a tent, but we can't do that this year. But of course the budget and Boyce Evans and his team have been working really hard to put together our budget. So the work continues, and rather than a big public announcement, I'll be doing an announcement Friday via short video and media release. So we're not going to have a large gathering because that's not allowed or safe, but I'll share the information through a video and then have all the detailed documents available to council and to the media and the public at the same time. So look for that on Friday, and it'll be up on the website at knoxvilletn.gov/budget. As you all recognize, that the shutdown in businesses and layoffs has hurt families, and it's also had an impact on the city's revenues. We're projecting a loss of 8 or 9 million due to the effects of COVID-19. So we're tightening our belt and focusing on only the most critical spending. So this is going to be a no-frills budget. But luckily, my predecessors, Mayor Rogero, Mayor Haslam, and previous mayors have all been good financial stewards, and we have fund balance and reserve funds. So we are going to, not have to be, we can still maintain our pension system. We're going to be able to take care of our infrastructure. We don't have to defer maintenance. And considering we're in the middle of a global pandemic, we're in strong financial shape and well positioned to withstand this financial hit. Our employees are our strongest asset, and they are get-her-done innovators and problem solvers who embrace public service and love Knoxville and its people. And it's our intent to weather this tough time and not to furlough our employees. On the back end of this, once the pandemic is in check and our businesses are fully reopened, our local economy will again be booming and our commercial corridors robust. That is certainly my hope, and I think yours too. So I want to thank you, Knoxville and City Council, for your patience and selflessness and for taking care of one another. And I'm really glad that we are Knoxville together. That says a lot about who we are. So that's my mayor's report, and I really appreciate again Dr. Buchanan's time. I know the main questions people had were really about some of the health department issues, so I appreciate that she was able to take time. Are there any questions from council members about stuff that I mentioned that aren't questions for me? Yes, Councilwoman Parker.
Oh, I just wanted to clarify when it comes to your order, safer at home order, whether you are in agreement with Dr. Buchanan that the city should follow the state, or are you following data to see if we will be ready by the time the renewal is up for the order?
Well, it's certainly my hope that we continue to see a flat curve with declining number of cases, or declining or flat number of cases. I do believe that we should be data driven and not date driven. But so far it is looking pretty good. And I think that there's, if we can reopen and lift these restrictions in a safe manner, I think that that's certainly something I'd like to do. I'd like to do it consistent with the health department's advice and in conjunction with Knox County. It's very confusing to the public if, there's a lot of different rules and regulations in our city versus other parts of town. I'm pretty confident that, Blount County, Sevier County, Loudoun County, Anderson County, all the counties surrounding us are going to be following, the governor's order. That doesn't mean we have to. So, but it means that they're going to be open and they're going to be. So, I guess I'm waiting to see more data. I'm waiting to assess that data and make a sound decision as much as possible. But that's my hope, is to stay consistent with the health department's work, because that is good for the community if we're all on the same page, and also work really, really hard to get that guidance out to businesses and to get the messaging out to the community that we may be lifting some restrictions, but that doesn't mean we're, even the governor has said he's going to be allowing some non-essential businesses to open, but under careful guidelines, and they're still not going to be allowed across the state gatherings of greater than 10 people, and trying to encourage people to still practice that social distancing. So I guess I'm adopting a wait and see attitude, but my hope is to be able to, that we continue to flatten the curve and that we can start lifting some restrictions.
I do have just another follow-up question. There's some concern there's lots of concern in the community, but one of those concerns is that once a safer at home order is lifted, folks will not see that as a gradual lifting of restrictions. They won't look at the blueprint, but they'll just go back to life as normal. Could there be a scenario where the safer at home order stays in place, but there are more businesses
Yeah,
allowed to open under it?
I think that raises up a good point. I mean, I think there's a difference between the messaging and rhetoric and the substance, and the way Governor Lee described it to city mayors and met, the mayors involved in the 6 counties that his safer at home thing doesn't directly impact, is that it's just going to be changes to non-essential businesses, and it'll be gradual and all this stuff. But his outside voice is like, let's lift all the, let's get back to work. And so it's sending this message out to people that the worst is over and we can get back to normal. But I agree with you completely. I think the message should be like, let's reopen, but gradually and safely, and we still need to be on guard, and it's a new normal. We need to make sure that the people of Knoxville and the surrounding counties, because they're coming into Knoxville to shop, they're coming into Knoxville to work, they're going to be coming into Knoxville to use our hospitals. So I definitely agree with you that I want the message to, so maybe we keep a safer at home order, but lift some restrictions and still call it the, safer at home order that's effective May 1st. And, round 2 of safer at home. These are, because I do think the messaging is really important, because businesses want to reopen, but they don't want to spread the illness to themselves or their customers. So that's a good point. And I'm certainly hoping to incorporate that kind of tone to the messaging, because there are a lot of vulnerable people. I've been getting just as many businesses have contacted me saying, please reopen the city for business. And I'm like, that's the goal. And then other people are saying, like, please keep everything closed down. I'm worried that I'm going to get COVID and, die. So we need to address those concerns in substance and in messaging.
Thank you.
Yeah, Ms. Testerman?
So we received notice that East Tennessee mayors are meeting tomorrow. Is that to talk about the reopening? Is it essentially going to be this dialogue, or are there going to be other topics you anticipate?
This is the Mayor Jacobs has mentioned.
Yeah, are you a part of that, or you?
He did mention it to me and said I'd be welcome to attend if I wanted. I have a conflict, so I don't think I'll be able to attend. If I can change my other thing, maybe I will. But my understanding is that they're just there to say that they support the governor's plan and want to move forward with that. So I don't think it's going to be a dialogue so much as an announcement of their support.
Okay.
So that brings up sort of the messaging thing. Like, I think there's a lot of overlap with what we want to do and how and when to do it, but there's a divergence a little bit in the messaging, because I'm like, we got to still be careful, and let's do this slowly and gradually and make sure that we're not going so fast that we have an outbreak that we can't contain. And I think everybody agrees with that in their sentiments and in their analytical mind as well. But the rhetoric is like, let's get back to business and open everything up. And I think that that sends a message that is a little less cautious than I think is appropriate and given our circumstances. So if you guys can help spread that message that, if the data still support us to lift these restrictions, which I sure hope they do, it'd be great if council can work with us as a city to say, good news, the curve is flat. We're able to lift some restrictions, but we still need to be careful. We still need to follow the guidelines. We still need to, limit our exposure to other people to the extent as possible while still, earning a living. So, wear the masks and where it makes sense, and use gloves, wash our hands, all those things. It's not back to the way it was in February. It's a new normal. Vice Mayor McKenzie, did you have a question? Yeah.
Yes, Mayor, I just thought of something I wanted to throw out there at you and possibly Chief Thomas, if she is on with us. This weekend, we saw people who were protesting. I'm not sure what the volume, the number of people that were out there, but of course it appeared from the news that it was well more than 10 people that were out there. with the governor's order not being lifted until the 30th, if we continue to see that type of behavior of large crowds gathering, what is our responsibility, or what, I guess first question is, were they given any type of notice to disperse, et cetera, this weekend? And if this were to continue into this coming weekend, what actions would we as a city need to take, just even for public health, since we're still under the guidance of less than 10 people gathering and the 6-foot distancing?
Well, I think this is a tough question because there's constitutional matters that, sometimes aren't consistent with these orders. And I mean, I think that, I don't think the police were off in a distance to make sure there was no issues with traffic or other issues. But I think there's another one planned by a different political group and political leanings this weekend. And, our general policy has been to, just make certain things are safe, but not to prohibit that because of, constitutional issues. But Chief Thomas, if you're on and you want to speak to that, but we're going to work with KPD and law and, try to treat everybody as fairly. And they were outside, and I think that I didn't attend or watch the event, but it's a tricky territory. So we'll work with law and KPD to, do our best to be consistent with the, constitutional right to assemble, and also trying to encourage people to practice good health things. Chief Thomas, did you want, I don't know if you're on, but if you want to speak.
Yes, Mayor, I am on, and you said it exactly right. There is a constitutional right. I actually was out there. There were probably between 80 and 100 by the time the event was over. It was very well organized. I can't say that everybody was 6 foot apart. They were not standing really close together, but they do have a right to assemble and free speech. So we are trying to walk that tightrope and make sure that everybody stays safe.
Okay, so to add to that, I want us to be very cautious because I'm not sure what the difference would be in that group of people who were protesting openly, and now it sounds like there were 80 to 100 people versus a group of young people who might be gathered, maybe let's say 20 to 30 of them in East Knoxville. Would we just monitor them from a distance as well? I just want to make sure that we're consistent.
I agree. I understand your concern. And I don't know what those young people would be doing. If they're playing basketball, something of that sort, then that's they're endangering themselves. And that's what the emergency order is for, is we're trying to keep people healthy. It's hard. It's hard. The right to free speech and right to assemble are guaranteed constitutionally.
Okay.
So it's a tightrope, and we look for the from the law department in these things as well.
Yeah. And Chief Thomas, thank you. In that scenario, I was speaking of just young people who were parked and standing around their cars talking, because if they're on a basketball court, that would be in violation. But if they're just hanging out, talking, I don't see any difference in that versus what we saw this weekend. So I just want us to be very, very mindful of that and the perception of what that could potentially lead to.
Thank you, Vice Mayor. Thank you, Chief. Any other questions at this juncture? Okay. Seeing none, that concludes my mayor's report. Are there any reports by council members? Councilwoman Parker.
Thank you, Mayor. I wanted to update the council on a couple of things. I've sent out a couple of emails with some concerns and just requests for more information around resources we might have access to that could be used to better serve some of our vulnerable populations, including homeless community. most recently, I shared some materials from the American Bar Association, National Law Center on Homelessness and Poverty. Haven't had a chance to follow back up on email, but wanted to update you all on this call tonight. But one thing I'm really interested to see from, the city, and we have the mayor's, budget presentation coming up next week, is a sense of how we are taking advantage of those funds during this time, and what our plan is to keep those vulnerable populations safe as a city. Obviously, the county plays a role, but the city does as well. And on our last call, we heard from the United Way, and I was concerned that there were some groups who were their work wasn't necessarily being included in the coordination efforts of the city. And so I wanted to invite some of the folks who've been doing some of that work to this call to share in my update to help us get a better understanding of what those needs are among our most vulnerable population, and what role these volunteers have been serving in our community to try to meet those needs. So I know that we have two individuals on the call with us tonight. And first, and there's one other person who was supposed to join us, but I don't think they were able to get into the meeting, and that was the Next Step Initiative. But many of us are very familiar with their work. The reason I wanted to invite them to the call is because I wanted everyone to get a sense of the level of outreach that they're doing on, the pennies that they're doing it with. And when they described to me a lot of the work that they're doing, it is something I would have expected either the city or the county to lead on. And so I wanted to see what our plan is going to be for next year. So I'm happy that the mayor has that focus in her budget presentation for next week. But since they cannot join us, I wanted to invite Keenan Grimes Community Outreach Center, who many of you all may have seen on social media, who's been very active. I've invited Mr. Grimes, Ira Grimes, from that group to share with us briefly. And I assume that do I direct all of this, or does Will do it?
Is this a committee or council member report, or would this be more appropriate to hear at public forum? Because, I don't know, this.
Yeah, no, it's a part of my report.
Okay. Well, should we keep a time, how many people do you plan to ask to speak?
I have two.
Okay, and they're both on?
Yes.
I've enabled Ira Grimes to speak.
Okay. Mr. Grimes?
Looks like it's still muted.
Well, he may have to unmute himself. I don't.
What's the button for doing that? Is it #6?
That's only if he phoned in. I believe he's joined over Zoom. It's *9 if he is telephoned in, but.
There's two connections, so that's likely that he has also called in. Mr. Grimes, are you joining us by phone? Can you press *9? Okay. Well, we can come back to Mr. Grimes and maybe, hopefully he can figure out how to join us. So next I'm gonna go to the First Aid Collective. And Klein has joined us from the First Aid Collective to share some information about the needs that they are seeing in the community. Thanks for joining us, Klein.
Yeah, grateful to be here. So yeah, my name's Caroline Rowcliffe and I go by Klein, but I'm speaking on behalf of the First Aid Collective of Knoxville. And we're an autonomous first aid wound care collective based here in Knoxville. And our mission mainly focuses around harm reduction and meeting people where they're at and not leaving them there. And FAC has worked with Choice Health Network's syringe service program for a little over a year now, where we've been supplying wound care, emergency contraceptive, and first aid supplies to people. And now presently in the time of COVID-19, we've been laying a lot of groundwork for mutual aid efforts around Knoxville because unfortunately, we knew that the city would fail its most vulnerable communities. So for the last month, FAC has supplied the homeless people with about over 600 lunches, hundreds of masks, about 1,000 naloxone kits provided by Choice Health Network. And we've also continued supplying people with contraceptive and emergency contraceptive. And these are only a few things that we've been doing while providing mutual aid to the houseless communities and other vulnerable communities in Knoxville. And while distributing essential supplies to folks, we asked them what they wanted shared the most at the city council meeting tonight. And one was that they have no food and people are starving while the city continues to not help them. And they also have nowhere to use the bathroom with businesses being shut down. Therefore, a lot of people are getting sick because they have no place to wash their hands. So FAC is a small autonomous collective of about 10 people. We're not a charity, we're not huge. We see people for people and are only doing what we do because the system is failing people. And while forming these relationships with houseless folks, we have made connections with a few EMTs whom say there have been about a 400% increase in overdoses since the pandemic really started to hit Knoxville. They also shared that they've been instructed to drop sick houseless folks off near the Salvation Army, whose doors are closed right now, which this will only continue to spread COVID-19 amongst the communities that continue to be ignored by the city. The recorded numbers of overall cases, the number of those that have recovered, and the number of those who have died because of COVID-19, unfortunately, most likely do not include those that are unsheltered because they continue to be treated badly by the police and even some doctors, or they don't have a form of transportation to get to testing. So if the city actually put money into social services instead of putting $700,000 of the mayor's budget towards the Knoxville Zoo, instead of putting $90,000 towards the election commission, and instead of continually increasing the budget for the police, less people would be getting sick and less people would be dying. FAC has seen firsthand, FAC, First Aid Collective Knoxville, has seen firsthand the effects that the pandemic has put on our houseless neighbors and other vulnerable communities. So I'm saying the city must put funds into social services. Houseless people need food resources and they need bathroom resources with running water. And lastly, I would like to add to read the recently shared 6 conditions for ending a coronavirus lockdown by the World Health Organization. 1, disease transmission is under control. 2, health systems are able to detect, test, isolate, and treat every case and trace every contact. 3, hotspot risks are minimized in vulnerable places such as nursing homes. 4, schools, workplaces, and other essential places have established preventive measures. 5, the risk of importing new cases can be managed. 6, communities are fully educated, engaged, and empowered to live under a new normal. Now, I wouldn't be speaking here today if I didn't care about the people of Knoxville. The reality is Knoxville has 0 out of these 6 conditions, as Knox County has decided to suspend free coronavirus testing on Wednesday because they don't have the supplies. If the city isn't able to demand more supplies, which was stated earlier, then more money must be put towards social services and resources for vulnerable communities, including but not limited to houseless communities, incarcerated people, etc., to reduce that harm. Restrictions like safe distancing can't apply to people in jails in the first place. A safer at home lockdown to lifting some restrictions, still without resources put in place for vulnerable communities, will guarantee an explosion in new cases come summer and fall, and people, parents, siblings, caretakers, etc., will continue to die. Thank you.
Thank you, Ms. Klein. Ms. Parker, I think this is more appropriate for public forum. This is not a committee report, and I encourage you to ask Mr. Grimes to sign up for public forum, and you know, that's a more appropriate way to have this. Council members, you know, I think if you agree, raise your hand or something. I mean, I don't know if this is a voting item, but like, this is not, I think, the intended purpose of this agenda item.
It really doesn't, it honestly doesn't matter because Mr. Grimes is not able to access the meeting. And that was my only speaker. But these are issues that I've been bringing up. You know, these are issues that the city has some control over: access to restrooms, access to hand washing facilities, increased funding for those who are providing food to those in need. And I wanted you all to hear firsthand through my report what those needs are, and from someone who's working directly with those vulnerable communities. So that's the end of my report.
Thank you. Any other council member reports tonight? Thank you very much. Elections and confirmations.
Yes, 8A is a resolution approving the reappointment of Howard Vogel to the Metropolitan Knoxville Airport Authority.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilman Roberto. Please do a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas, Councilman Thomas,
Sorry. Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
9A is an ordinance to amend the operating and capital budgets for fiscal year 2019-2020.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilman Smith. Any discussion? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
No.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Okay, with an 8-1 vote, with Councilman Parker voting no, this motion passes. Next item, please.
9B is an ordinance appropriating the sum of $1,000 from the community empowerment budget and donating same to Next Step Initiative through its fiscal agent, Community Shares, to be utilized toward a series of activities to support children and families from Montgomery Village.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilwoman Ryder. Any discussion? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes. Motion carries 9-0. Next item, please.
9C is an ordinance appropriating the sum of $6,000 from the community empowerment budget and donating same to youth outreach in science, technology, engineering, and math to be utilized toward its Girls in STEM program.
Move to approve.
Second.
Motion made to approve, was that by Vice Mayor McKenzie?
Yes.
Yes,
And
ma'am.
seconded by Councilman Roberto. Any discussion? All those in favor, please do the roll call vote and just vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
9D is an ordinance appropriating the sum of $10,000 from the community empowerment budget and donating same to Freedom Village of Hope as fiscal agent for the East Tennessee Freedom Schools program to host summer enrichment programs.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilman Smith. Any discussion? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
9E is an ordinance appropriating the sum of $15,000 from the community empowerment budget and donating same to Penultimate Development to be utilized toward its Penult Leadership Development Program.
Yes. Move to approve. Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilwoman Ryder. Any discussion? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
9F is an ordinance to approve 4 minor amendments to the Knoxville City Code Appendix B zoning code as more fully set out herein. Knoxville, Knox County Planning applicant, all districts.
Move to approve.
Second.
Motion made to approve by Councilman Roberto, seconded by Councilwoman Ryder. Any discussion? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
Motion carries 9-0. Next item, please.
9G is an ordinance to adopt the one-year plan dated 2020 as prepared by the Knoxville, Knox County Planning Commission for the city of Knoxville, all districts.
Move to approve.
Second.
Motion made to approve by Councilman Roberto, seconded by Vice Mayor McKenzie. Any discussion? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
Motion carries 9-0.
9H is an ordinance to rezone property located at 2811 Merchant Drive, parcel ID 080HC03302 from RN1 district zoning to O district zoning. Bob Alcorn Architects applicant, 3rd district.
Move to approve.
Second.
Motion made to approve by Councilwoman Singh, seconded by Councilman Smith. Any discussion? Seeing none, all, please conduct a roll call vote.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto.
Yes.
Motion carries 9-0. Next item, please.
11A is a resolution respectfully requesting Knoxville, Knox County Planning to conduct a small area study for the industrial area generally located in the vicinity of the area bounded by North Avenue, Central Street, Radford Place, and Pershing Street.
Move to approve.
Second.
Motion made to approve by Councilman Thomas, seconded by Councilwoman Ryder. Any discussion? Councilman Thomas.
Yes, briefly, the area designated to be studied includes the Fort Loudon Recycle Facility. As we all know, that was the site of the hazardous fire in May of 2019. It's an area that definitely needs some attention, so I would appreciate the support of my colleagues. Thank you.
Thank you, Councilman Thomas. Any more discussion? Seeing none, please conduct a roll call vote.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman.
Yes.
Motion carries 9-0. Next item, please.
11B is a resolution authorizing the mayor to execute any and all documents to award an amount not to exceed $642,752 in historic preservation grant awards to support property improvements to eligible historic properties within the city of Knoxville.
Move to approve.
Second.
Motion made to approve by Councilwoman Ryder, seconded by Councilman Roberto. Any discussion? Seeing none, please conduct a roll call vote.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
No.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker. Councilwoman Parker,
As I'm ready to vote, I now have a question.
I think the time has passed for questions. You know,
I think so.
I mean, you're the last vote.
I know. Yeah, it has passed. I'll just abstain.
You're going to abstain?
Yeah.
Okay. Does that conclude the voting, Mr. Johnson?
the vote was 7 in favor, 1 against, with 1 abstention, ma'am.
Okay, thank you. Please go on to the next item.
11C is a resolution authorizing the mayor to enter into an easement agreement to allow existing and proposed building elements to encroach into the public right-of-way for East Jackson Avenue at 125 East Jackson Avenue.
Move to approve.
Second.
Motion made to approve by Councilwoman Testerman.
Correct.
seconded by Councilwoman Ryder. Any discussion or questions? Hearing none, please conduct a roll call vote.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes. Yes.
yes, thank you. Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith.
Yes.
The motion carries 9-0. Next item, please.
11D is a resolution authorizing the mayor to execute an agreement with Gresham Smith to provide professional design services for the advanced traffic management system along Middlebrook Pike for an amount not to exceed $495,347.60.
Move to approve.
Second.
Second.
Motion made to approve by Councilman Roberto, seconded by Councilwoman Ryder. Are there any questions or discussion? Ms. Singh?
Thank you, Mayor. This is 100% grant funding, or we're matching it 50-50? I guess engineering.
Yeah, is Steve King on, or David Brace? Could one of you address that question, please?
This is Steve King. It is 100% funding.
Okay.
Through
Thank
TDOT.
you. Okay.
Thank you, Mr. King. Any other questions? Or Ms. Singh, did you have any other questions?
No, thank you.
I have a question.
Ms. Parker?
For this grant, how did the engineering department determine where to implement the program, the system?
Mr. King, if you could address that, please.
Yes, Steve King again with engineering. We have a program to look at all of the major corridors in the city. We already have some contracts underway that we have this opportunity through this particular type of funding, which is CMAQ, congestion mitigation air quality funding. As we get opportunities, we apply for the grants and bring that to council.
And so are you determining where there's the most congestion where you prioritize projects?
We already have contracts on some of the more major corridors like Kingston Pike and Chapman Highway, and we had the opportunity to add University Middlebrook to that list for ATMS.
I just want to interject, Mr. King. I believe we've also already approved funding for the Broadway corridor for this particular type of funding as well.
Yes, you are correct.
I don't mean to jump on Councilwoman Parker's question. I was like, we voted on a lot of this funding in the past. Do you mind explaining, since we haven't talked about it in a while, what exactly this does? It basically turns our red lights from dumb lights to smart lights, because we kind of have dumb lights right now, correct?
Yes, that's correct. The primary problem with traffic signals is, it's just like a old personal computer. The controllers need to be replaced, but there needs to be better communication between those controllers. So one of the major parts of the advanced traffic signal program is to provide fiber optic communication between the signals along major corridors. That enables us for the controllers to communicate better, for us to provide better congestion management and better timing and progression for the signals.
Thank you, Mr. King. Ms. Parker, do you have more questions?
Yeah, I just wanted to say that these types of upgrades, I think, are important for our city and can meet several goals, including reducing idling time. I've met with the mayor about this and, pushed in our efforts to invest in this area. I won't hold up the call, and I'll follow up with Mr. King afterwards. What I was trying to get a clear sense of is how we prioritize the certain projects moving forward. I understand we've already approved projects in the past, but I wanted to get a sense of what that process is. If there's a complaint system, if it's congestion that's tracked, but I'll follow up with Mr. King. Thank you.
Thank you. Ms. Ryder, did you have any follow-up questions?
No.
Any other discussion or questions on this agenda item? Mr. Thomas?
Oh, just a brief comment. The benefit of doing one of these studies or be able to implement this is, as Ms. Parker mentioned, is the idling time, which not only slows down traffic, but it's a problem with the environment. Cars sitting at a stoplight and it's not going anywhere and it's just polluting the air anymore. So just thought I'd make a little comment on some of the side benefits of this. Thank you.
Thank you, Mr. Thomas. Any further discussion? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
Motion carries 9-0. Next item, please.
11E is a resolution authorizing the mayor to execute any and all documents necessary to apply for and accept a grant on behalf of the Knoxville Police Department from the U.S. Department of Justice Office of Justice Programs in the amount of $300,000 with a required local match in the amount of $300,000 for a total grant amount of $600,000 for funding of the purchase of 400 body-worn cameras for Knoxville police officers.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilwoman Testerman. Any discussion? Seeing none, please conduct any questions? No. Okay. Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
11F is a resolution authorizing the mayor to execute any and all documents necessary to apply for and accept a grant award from the U.S. Department of Justice Bureau of Justice Assistance in the amount of $349,956 with no required local match for the fiscal year 2020 Coronavirus Emergency Supplemental Funding Program to assist in preventing, preparing for, and responding to the coronavirus pandemic.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilman Roberto. Any discussion or questions? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker, Councilwoman Parker,
Sorry, y'all. Yep.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Please go on to the next agenda.
11G is a resolution authorizing the mayor to execute any and all documents necessary to apply for and accept a grant from the State of Tennessee Highway Safety Office in the amount of $71,000 with no required local match to purchase radar, LiDAR handheld speed guns and to provide for overtime costs to enforce impaired, distracted, or aggressive driving, occupant protection, and speeding.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilwoman Ryder. Any discussion or questions? Ms. Singh?
Thank you, Mayor. I guess this is for Chief Thomas. This item and then the next one, H, I understand that they are all grant funded with a certain purpose. But my question is about that both of them are saying that there will be funds going for overtime hours. Is this because we're understaffed with the police department?
No, this has more to do with providing traffic enforcement with off-duty officers using overtime so that we don't take away from those beat officers' time on their beats.
I'm sorry, I couldn't understand that.
Okay, can you hear me now?
Yes.
Okay, this has more, the overtime, it has more to do with being able to staff that targeted enforcement with off-duty officers so that we're not taking beat officers away from the community.
Okay, so is that a reflection of being short-staffed or
No,
different?
not
Okay.
at all, not at all.
Okay, thank you.
Any other questions or comments? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
11H is a resolution authorizing the mayor to execute any and all documents necessary to apply for and accept a grant award from the State of Tennessee Highway Safety Office in the amount of $33,000 with no required local match to provide enhanced safety enforcement and to purchase supplies for use in bicycle and pedestrian safety campaigns.
Move to approve.
Second.
Motion made to approve by Vice Mayor McKenzie, seconded by Councilwoman Singh. Or Councilman Thomas.
I think it was a tie.
Okay,
Oh,
I'll give it to Lauren.
okay.
it's okay.
Any questions or discussion? Seeing none, please conduct a roll call vote.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit.
Yes.
Motion carries 9-0. Next item, please.
11I is a resolution authorizing the mayor to execute an agreement with Iams Nature Center to provide trash and debris removal services for the waterways from Forks of the River to the end of Sequoia Park for an amount not to exceed $41,400 annually.
Move to approve.
Motion made to approve by Councilman Roberto, seconded by Councilwoman Fugit, I think. Any discussion or questions? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder,
Yes.
Motion carries 9-0. Next item, please.
12A is an emergency ordinance enacting a moratorium of 120 days upon the granting of any application for new institutional zoned parcels and upon the granting of any new sign applications in institutional zones, while the Stakeholder Advisory Committee and Knoxville, Knox County Planning Commission study and to make a recommendation to City Council if Article 13.9F of the City of Knoxville zoning code should be amended to create sign regulations in institutional zoned districts.
Move to approve.
Second.
Motion made to approve by Councilman Roberto, seconded by Councilwoman Testerman, or was it Ryder?
I had Ryder.
Ryder, okay. Sorry, it's hard to sometimes figure it out. Thank you. Councilman Roberto.
Thank you, Mayor. This is, we've had a 120-day moratorium on this while there was a chance to study it that was enacted back in December. And so we're here again because we're not ready yet. I had a very good discussion today with Aaron Gill from the administration and also Gerald Green and Amy Brooks. I think everyone's in agreement that, you know, this is an issue that needs to be studied. And I know there is a proposal that I believe Joyce Feld had sent out to all council members today that came from Scenic Knoxville and also from Community Forum of a proposed structure framework for a way of dealing with this zone. I know Director Green is here today, so we can answer some questions. Basically, what we want to see is for this to be able to come up in a way for council to debate this this proposed structure and standards thoroughly and cleanly, and be able to vote on what we want to see here. But we do need some extra time to do that. In those discussions, I think there's a lot of desire to get this this decided sooner than later, and so I don't think we need the 120 days anymore. I think we can amend that to 90 days. I know that Councilperson Ryder has is on this as well, so I would make that motion that we can change this to 90 days as opposed to 120 based on those assurances. But I'm available to answer questions, or if Councilperson Ryder has is in agreement with that as well.
Let's see if there's a second on the motion to change from 120-day moratorium to 90 days. That's the motion to amend on the floor. Is there a second?
I'll second the motion to amend the time.
Okay, motion made to amend by Councilman Roberto, seconded by Councilwoman Ryder. Ms. Fugit, do you have a question about the amendment?
Mayor, so just a logistical question. Why do we need to amend the motion down to 90 days if it came back before us and we voted on it to institute it? Would that negate the necessity of the 120? Maybe that's a legal question. Andrew, you're the attorney. I assume you knew that when you made that, but for us lay folks, I would think we could have left it alone and just come back sooner.
And to answer your question, I don't think this is a legal answer. It's more of a pressure answer. If what we had found in the 120 days is, hey, that seems like a long time. And so it didn't really get dealt with. But if we do it shorter,
this is a motivator.
Go ahead, sorry.
This is a motivator.
Yes, so I think that's it. Now, the issue is if we don't get to a place where it can be reviewed in that 90 days, then we can always come back and do this. The other thing to keep in mind is that the stakeholders is taking this up tomorrow. And so it'll be really good to hear from them. And yeah, so that's why the 90 days. It doesn't prevent us from dealing with something in the future, though.
Okay, that's fine. You answered my question. It's really, we think we can be done sooner, and it's also an incentive to keep it moving.
Thank you. City Council Attorney Rob Frost is asked to be recognized. Mr. Frost?
Thank you. Actually, the way the moratorium, it's 120 days, but it can be changed by later ordinance to shorten the time if necessary. It's the same for both this one and the next one, I believe.
Thank you, Mr. Frost. Any other questions about the amendment, which is changing it from 120 to 90 days moratorium? Seeing no questions, please conduct a roll call vote on the amendment.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
It keeps changing the order, so it's hard to know who.
I usually start with the motion maker
Okay.
to give
I just know
people.
where you end. I need to know where you end, not where you start.
Oh,
Okay.
sorry.
9-0. Now back to the original motion as amended. Is there any further discussion or questions about the motion? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
Motion carries 9-0. Motion as amended. Next item, please.
12B is an emergency ordinance of the Council of the City of Knoxville enacting a moratorium of 120 days upon the granting of any new sign applications under Article 13.9 F5E of the Knoxville City Code, zoning code, while the Stakeholder Advisory Committee and Knox County Planning Commission study and make a recommendation to City Council if it should be amended to have sign applications reviewed by the Board of Zoning Appeals or otherwise limit the zones where Knox County Planning Commission may grant additional signs to be more consistent with those limitations in the former sign ordinance.
Move to approve.
Second.
Motion made to approve by Councilman Roberto, seconded by Councilwoman Ryder. Discussion, Councilman Roberto.
Thank you, Mayor. Likewise, this is another 120-day moratorium that was enacted back in December. Again, in those conversations I mentioned in the previous item, there's been discussions about that, this needs to be brought cleanly in front of council for a vote. There is still more study being needed here. So I'm comfortable based on those discussions and those assurances that we can probably accomplish this in 90 days, and to be able to do that with maintaining some level of I don't know, helping to move things along, I think, as we said it before. So I think the 90 days is appropriate in this instance as well as the last. So I'd make a motion that we change it from 120 days to 90 days as well, keeping in mind that we can come back and change this again later if we needed to.
Okay, I'll second that motion.
Motion made to amend it from 120 to 90 days, made by Councilman Roberto, seconded by Councilwoman Ryder. Any discussion about this amendment? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
Motion to amend carries. Now back to the original motion. Any further discussion or questions about the original motion as amended? Seeing none, please conduct a roll call vote.
Councilman Roberto,
Yes.
Councilwoman Singh,
Yes.
Councilman Smith,
Yes.
Councilwoman Testerman,
Yes.
Councilman Thomas,
Yes.
Councilwoman Fugit,
Yes.
Vice Mayor McKenzie,
Yes.
Councilwoman Parker,
Yes.
Councilwoman Ryder.
Yes.
Motion carries as amended 9-0. Next item, please.
We are at public forum now, ma'am.
Okay, has anyone signed up for public forum?
Yes, ma'am. We had David Hayes and Rick Roach had both signed up for public forum.
Okay,
Mr. Hayes, if I don't see your name in the pool, if you phoned in, you can hit *9 and we can recognize you. Otherwise, I don't see that he has joined our meeting. Oh, here he is.
Mr. Hayes, are you on?
Yes, can y'all hear me?
We can. So go ahead and you'll have up to 5 minutes. Start by stating your name and address. Thank you.
Okay, my name is David Hayes, live at 1312 Hawthorne Avenue. And I signed up to also speak at the budget item 9A when y'all was passing the new budget items concerning the Knoxville Zoo. So I'm disappointed that my name wasn't called on.
That was my fault, Mr. Hayes. I apologize. I just missed it.
Yeah, well, I thank you so much for the apology. I know y'all wouldn't want to keep other opposing views silent, so I appreciate the apology. I just wanted to start off by stating some dynamics within today's agenda. We had, of course, the $700,000 given to the Knoxville Zoo, and we had over $1 million given to Knoxville Police Department, and we had only $32,000 going to social services in the form of community empowerment. So just to hit on the zoo dynamic, you know, I know it was said a lot that the city doesn't want to be in the zoo business. Therefore, we had to get this money over. But, you know, the zoo had other streams of income it could have actually dipped into, right? And the question of whether we should be in the zoo business or not, that should have actually been fleshed out. That should have actually been studied. You know, we should have actually studied the pros and cons of what that would look like. You know, maybe the city could actually be more efficient, right? Maybe the city can make sure the workers are paid a living wage, you know, and maybe the city can make sure that the East Side actually had a say in how the zoo impacts their community. So there was a whole discussion there that could have been had, but wasn't. And in terms of $1 million to Knoxville Police Department, you know, we continually, you know, don't fund the root causes, you know, in solving the root causes. And that's reflected in only $32,000 going to community empowerment. So those are the wrong priorities. And as revenue is going down in the city, we want to make sure that we don't see any austerity, all right? We don't want to see crumbs going to social services and housing, and we need to see those things prioritized because as things get rougher, social services and resources are actually going to be even more important. And I know there is a lot of, you know, we have some hands behind our back, honestly, because of the way our state government is overreaching into local government. So there's actually been a statewide coalition of over 30 groups, community groups, labor groups, political groups, come together and set forth some demands for our governor. And I wanted to uplift those to let the city know that there are people who are actually pushing back against what's going on at the state level. And we don't just have to follow the lead of the state. We don't have to follow the lead of the county. We can actually be leaders ourselves, and we can actually push back against what harms us and promotes what's actually good for our communities. So I'm just going to highlight the 6 demands that came from this group. And it's the demands are titled, this is an open letter to Tennessee state and local elected leaders about the COVID-19 response. Stand Up Nashville released this. But as I said, over 30 groups across the state endorsed it. So the first demand of the state is to allow local governments to make sure all employees in their county have paid sick time so they don't have to choose between public health and paying the bills. Second would be to allow local governments to expand the criteria for the property tax freeze program while they confront budget shortfalls caused by adherence to social distancing and the latest public health guidelines so they can protect people who have lost their jobs. Third, to ensure immigrant communities feel safe interacting with local health departments and other government agencies so local communities can keep all their residents safe and healthy. Fourth, allow local governments to prioritize the creation of employment opportunities for local residents on public projects. 5, allow local governments to ensure that businesses they contract with are providing good jobs that boost the local economy and provide economic stability to the families during the economic downturn created by this crisis of COVID-19. And 6, lastly, allow local government to make necessary laws to ensure that housing remains affordable and to incentivize/require building new affordable housing. So this is just an example of ways at a local level we can push back from the restrictions and overreaching we're seeing from the state government. I hope y'all join the cause. And again, especially speaking to you, Mayor Kincannon, you know, stand strong on your values. You know, the people elected you to make sure all Knoxvillians are good. And within the county, within the state government, they don't have the same priorities. So the people will support you if you make the adequate measures to keep our people safe and not just cave to the right and business interests. Thank y'all.
Thank you. Next, Mr. Roach. Mr. Johnson, do you know if Mr. Roach is able to access the meeting?
He is in the pool. I have enabled him to speak. He is still muted. I believe he joined the meeting by Zoom, so he should be able to unmute himself. Mr. Roach, are you here? If you happen to phone in, if you'll hit *9, or rather *6 this time, and you can unmute yourself.
And if you're on Zoom, the unmute's in the bottom left-hand corner. You have to put your cursor down there to indicate, you know, show the icon. Let's give it another little bit, see if Mr. Roach is able to access it.
Can you hear me?
Yes. Okay, Mr. Roach, if you could just start by stating your name and address for the record, and you'll have up to 5 minutes to speak.
Yes, this is Rick Roach, 2404 Victoria, Knoxville, Tennessee. I have a question. Well, not a question. I want to bring something to council's attention as regards priorities, future priorities. The city of Knoxville has multiple relationships with multiple financial institutions. And going forward, because of the peculiar situation that we're in now, I would hope that city council would try not to do business as usual in terms of how how housing is addressed, especially in terms of the financial institutions and the roles that they have to play in facilitating any type of housing justice here in Knoxville. In particular, I would ask that there be a focus on when you're dealing with any particular and entering into any type of relationship with a financial institution, no matter what has happened in the past in terms of a working relationship, that you really start to look at the financial institutions and the record that they have overall in terms of housing and the people that they have historically excluded or underserved. As an example, more than likely, we have several financial institutions that the city may have done business with in the past in different ways that openly, some of them got caught, some of them didn't. Some of them entered into a type of compensatory relationship once they got caught, consent decree or whatever you want to call it. But they discriminated against particular groups of people, primarily people of African descent, primarily people of low to moderate income, and the city of Knoxville, to my understanding, still has a strong relationships with these entities. So I would ask that you start to look at and keep in mind some of the things that are required in terms of national regulations, federal regulations, such as the Community Reinvestment Act, that there be an emphasis on these institutions showing before you enter into any type of relationship with them in the future that they are doing their damnedest to comply with all regulations and all non-discriminatory provisions. We've had financial institutions in this community, even though they don't like the word, they have pretty much invested themselves into the process of redlining.
Mr. Rich, you have 1 minute to go.
All right. So within that, with that knowledge, as you proceed forward now, because this is a perilous time, as we start to quote get back on track, that you not do business as usual, that these institutions are made to account for themselves, and if they come up lacking, if they show to be lacking, don't do business with them, and have them, comply. If they're underserving a community, and this information can be acquired, okay? It's not hard to come by, and you should be focusing on that in order to make sure that all the underserved communities in Knoxville have access to capital, whether it be for home ownership or for commercial purpose.
Mr. Roach, that is your 5 minutes is up.
All right, thank you.
Yeah, thank you for your time. Mr. Johnson, has anyone else signed up for public forum?
No, ma'am.
Okay, hearing that, this meeting is adjourned. Thank you all. I'll see you soon, or at least by Zoom.
Thank you.
Bye-bye. Good night.
Bye, good night.